welcome to our podcast, Five Shades of Ethics. My name is Viana Nazarzadeh, and we're really happy you're taking the time to listen to our discussion today. I'm here with all these beautiful third-year nursing students, and today we're exploring the ethical dimensions of health issues experienced specifically by rural and remote residents. And it's very important because this population are very overlooked in Canada, but we'll get to all the details later. For now, I'd like to take the time to introduce to you every single one of these beautiful ladies.
Hi, I'm Sam Trudell.
Hi, I'm Rhiannon Perry.
My Melissa O'Meara. Hello.
And I'm Miriam Mustafi. Hi.
So to get us started today, Melissa, could you please explain what we're focusing on and why this population is experiencing vulnerability?
Yeah, so today we'll be focusing on rural and remote communities. Rural is referring to small towns, villages, and countryside. Both are just people living outside cities, and remote communities are more isolated than rural, such as mountain communities, northern communities, and other geographically difficult to access areas. They experience vulnerability because they have limited healthcare, food insecurity, and understaffing. So, why should we as nurses find this topic interesting and important, ladies?
This topic is really important because it shows a specific part of our population that experiences daily living differently than how we would here in Ottawa, which is, primarily more urbanized area. So it's important to have an understanding of communities outside of our own, such as smaller rural ones, so it can broaden our perspective with the goal of continuing to practice so that we can continue to practice cultural competency. Now, with that being said, we're all nursing students here, so why should we as future nursing students care?
Nurses working in rural areas are at risk of experiencing moral distress because they may be presented with the problem of wanting to help someone but not having the resources to provide the best care. Nurses experience moral distress when they know what should be done, but policies or institutions restrict their ability. In rural and remote cases, nurses may also be restricted logistically when they're lacking resources or short on staff. Hey Miriam, what should nurses do about this? How will this make a difference or an impact?
That's actually a really good question. As nurses, one of the most important things we can do is practice relational ethics. We need to be able to understand the real life circumstances of the people that we're caring for, and not just see them as patients and their medical needs. For rural and remote communities, this starts with listening, learning, and acknowledging the challenges they face. Like limited transportation that they face with, fewer health services, and cultural differences. Nurses can actually make a huge difference by advocating for more resources, providing culturally safe care, and building trust within the community. Even small actions like learning about the community's available foods, social supports, or cultural norms can make a huge, huge difference and improve how we care for these people. Vienna, what do you think are some Canadian statistics about this issue that you can tell me?
Honestly, the stats clearly show like how people living in smaller or remote communities really face like significant vulnerabilities. About like 18% of Canadians live outside major urban centers, but
Mhm.
only 8% of the country's physicians serve those regions, which is a major gap in access to care for them. And because of this shortage, individuals really in those areas experience higher mortality rates from trauma, cardiac events, or often simply because emergency services are out of reach for them, which is very unfortunate.
Wow, so does this mean that people who live farther have poorer health outcomes, you would say?
Unfortunately, yeah, that is the result of it because people who live further, they have a very high rate at chronic diseases, more mental health challenges, and like limited access to specialists. And altogether, really, these numbers show that geography itself acts as a structural barrier, shaping health outcomes in ways that like many Canadians in urban settings, they may not experience. Thank you so much for that question. It really marks out an important reminder that stats help us understand really how deeply these inequities affect individuals and communities. And that actually brings me to a question I have for Melissa. What ethical considerations do you think are especially important for nurses when we're caring for rural and remote like residents?
Yeah, so there are many ethical considerations and perspectives regarding nursing practices in rural and remote communities. So, looking at some bioethical theories, there's deontology, which focuses on the idea of doing what is right, Even when staffing, equipment, or resources are limited, a deontological approach emphasizes that nurses still must practice within their scope and know their own limitations, seek consultation or transfer when care exceeds their scope, and to ensure safety even when it takes more time.
Okay, I agree. Could you give us an example of how a nurse could do that in real life?
Yeah, of course. So if an emergency arises and there's no physicians available, the nurse follows protocol and scope of practice standards rather than trying to improvise some risky care. And another bioethical theory that we can look at is virtue ethics, which kind of focuses more on the character of the nurse. So, who the nurse is and the moral qualities that they bring to practice. One of these qualities that is really important is compassion. So, rural and remote residents often experience health inequities, long travel distances, or chronic understaffing. And a virtuous nurse responds with compassion by showing patience during long wait times or stressful situations. They can understand the challenges that the families face and provide emotional support when specialist care might be far away.
Why is compassion so important when it comes to rural and remote communities?
Yeah, so compassion strengthens trust in small communities and it can promote patient-centered care. Because these communities are smaller, more isolated, and mostly understaffed, trust becomes a foundation for safe, effective, and ethical care.
Hmm.
Although within Indigenous communities, the master narrative of healthcare can sometimes create a barrier to trust.
This is so important to talk about. What is the master narrative of healthcare?
So, the master narrative of healthcare refers to the dominant Western biomedical story that shapes how health, illness, care, and good practice are understood. This narrative assumes that Western knowledge is superior, universal, and value neutral.
I feel like a specific community here in Canada that has been wrongly affected by the master narrative is Indigenous communities. Wouldn't you guys agree?
Absolutely.
Absolutely. So, Indigenous communities carry a collective memory of medical racism, forced removals, and medical experimentation, and residential health school abuses. So, when nurses act from the master narrative, some patients may feel mistrusted, misunderstood, unwelcome, or unsafe. So, without trust, therapeutic relationships are weak, making care less effective and less ethical.
That's a very good point. What is the effect of practicing like solely from Western medical knowledge?
Yeah, so if nurses rely solely on the Western master narrative, they might miss culturally meaningful cues. They might provide care that doesn't reflect the community needs or overlook traditional healing practices. So care would essentially become culturally unsafe, ethically shallow, or even harmful to the population. To provide ethical care, nurses must disrupt this narrative by practicing cultural humility, valuing Indigenous worldviews, acknowledging historical trauma, and building trust based, community centered relationships.
It's so true, Melissa. Indigenous communities here in Canada definitely face unique difficulties because of westernized healthcare. And as you said, it overlooks their own practices and minimizes their voices. I actually read a study about Northern Ontario, a small community there, and interviewed about a small handful of nurses about their experiences in these unique rural communities.
Mm.
Interviews were super insightful, describing some of the unique situations that these healthcare providers and residents do experience.
Okay, that's really cool. How does culture affect this, Sam?
So as we discussed, these communities are small and they're unique. They often share a similar culture that is specific to their residents. So because of this, a common theme in the article highlighted to was resident care and risk to resident care. One of the participants shared that limited access to doctors caused the nurses to have to make calls that were what they felt were far beyond their scope of practice, beyond their responsibility as a nurse. And looking at the code of conduct, this violates the code that nurses should always provide safe and competent care. It kind of put the nurse in a hard place to be able to do that because of lack of resources.
It's actually great that you mentioned the CNO guidelines because I was going to ask you, what does it say about this when it comes to the nursing practice?
Yeah, so another really important one that can be impacted by providing care in a rural community is that nurses should always act with integrity in clients' best interest. So specifically, the nurse noting any conflict of interest and always trying to maintain professional boundaries with the client. This can be difficult in small communities because everybody knows each other, and it can be hard for some residents to find a healthcare provider that doesn't have some sort of conflict of interest in their own lives. you might see, nurses might see their clients at the grocery store, at the same church, same town events, and it can pose a problem for sure.
Yeah, it can get awkward for sure.
Mhm.
What's at stake here, Sam?
Confidentiality, just in general, this goes back to the idea that everybody knows everybody, and people know each other on a deeper level than that of an urban area. This can also prevent clients and patients from coming in and being open about their problems in order to receive the best healthcare because maybe they're nervous or that confidentiality is at risk. And then also another thing at risk is just the best health outcomes. And this is simply because of increased travel times, limited access to resources, and possibly limited staff. So yeah, now that we've discussed what's at stake for these populations, including the difficulty for healthcare providers, what are some ethical arguments that we should consider?
Yeah, Sam. So we found an article talking about a small rural community with increased homelessness. The article discussed the lack of outreach nursing for remote residents and how it would be beneficial if there was funding to implement street nurses, specifically because homelessness is expanding outside of urban areas. This is something we as student nurses should be thinking about if we ever practice in these smaller communities. Funding, education, cultural safety are areas we should anticipate needing advocacy and awareness for vulnerable populations in small rural communities.
How is confidentiality affected here, actually?
Yeah, Vienna, when we think about confidentiality and policy, there are many ethical issues worth bringing to light. Institutions in remote areas may have unspecified guidelines and policies regarding professionalism and confidentiality, as nurses are expected to practice with more autonomy. Lines may become blurry when the nurse is close with members of the community or is seeing a client frequently and develops a closer therapeutic relationship. Miriam, how does this all impact nursing and healthcare in an Ontario local perspective?
So my argument is based on the principles of equity and justice. I believe that rural patients in Ontario deserve the same quality of care as those who live in the urban areas. This also connects to autonomy and beneficence, doing good, because limited services and delays in care can cause harm that can be preventable. In Ontario, many Indigenous and rural communities face significant gaps in healthcare access. Nurses working in these regions often have fewer resources and higher workloads. Patients may need to travel long distances for even basic services, which delays care and leads to worse health outcomes. This directly impacts nursing practice by increasing stress, requiring more complex decision making, and creating a greater need for advocacy and culturally safe care. Improving rural healthcare in Ontario is very, very important for achieving health equity and supporting the nurses who care for these communities.
Thank you so much for that, Miriam. I actually would like to take a minute to bring together some of the points I introduced earlier, especially the stats, because they highlight that these aren't just gaps in healthcare delivery. They're mainly ethical failures that directly challenge our responsibilities as nurses. And the data makes it very clear, that these communities and remote residents experience systematic barriers, which violates core ethical principles, literally like equity, justice, and just the right to safe and timely access care. Wouldn't you guys agree?
Absolutely.
Yeah.
So, Vienna, how do these issues look through a nursing ethics framework?
So when we look at these issues through nursing ethics frameworks like relational ethics, moral agency, and cultural safety, we start to see the deeper implications. Relational ethics reminds us that meaningful, respectful, and context-aware relationships are harder to sustain when patients are geographically isolated. And moral agency really challenges us as nurses to advocate for change when we witness structural inequities. And cultural safety pushes us to recognize how geography intersects with culture, particularly for Indigenous rural communities, shaping their health experiences and their trust in the system.
What do these concepts help us understand about rural health inequities?
That's a very good question because together these ethical concepts They help us understand that the health inequities in the community are not accidental. They are the result of systematic structures that we as future nurses have a responsibility to question and really try to improve. Before we move on to our closing thoughts, though, is there anything else anyone would like to add about what we have learned in class as well?
Yeah, I have something to say about moral agency.
Yeah, absolutely.
When we think about moral agency, we're talking about the nurse's ability to be able to do the right thing, even when the situation is hard. And honestly, in rural and remote communities, that comes up all the time. Nurses are constantly making decisions with way fewer resources, smaller teams, and sometimes long hour delays in getting higher level care.
Yeah, I totally agree. That actually reminds me of the study we were talking about earlier, that nurses commonly said they are stuck without a moral nursing community and resources from other healthcare staff, which has kind of caused them to make choices that are outside of their scope, causing their choices to be sometimes ethically risky. Placing unrealistic expectations of nurses and their scope of practice can cause them to also experience some moral distress. So, how can nurses practically integrate moral agency in these difficult situations?
So, moral agency in these settings often look like nurses advocating for faster transport, speaking up when the system isn't supporting families, or finding creative ways to keep people safe when options are limited. Rural nurses end up stepping into these expanded roles that makes moral agency not just a nice idea, but something necessary for ethical practice out there.
Yeah, and honestly, these moral agency, like wanting to provide care and sometimes being restricted to, can shape our moral identity. It shapes how we provide care for other people. It shapes how we feel about our jobs. This is maybe why self-reflection is so important, and debriefing with, your healthcare peers as nursing students. We have a lot of peers in our circle that we see every day that, talking about it and addressing our own moral agency can prevent maybe moral distress.
But what about the emotional side of ethics? How do rural residents and nurses actually experience these ethical changes in real life?
That's a very good question. Honestly, moral experience is really about what it feels like to be inside these ethically charged situations, especially for families in the communities. That often means like feeling isolated or scared when care isn't accessible, and that's very valid. And for nurses, it can include real moral distress, knowing what a patient needs, but not like having the resources to provide it. These experiences really stay with you as a person, and they shape how both patients and nurses really like understand what ethical care really means in that context. Thank you so much for that question. And as we come toward the end of our podcast, Five Shades of Ethics, I want to bring together the ethical ideas we explored today. The challenges faced by rural and remote residents aren't just service gaps, though. They raise real ethical concerns that affect nurses every day. And these concepts like moral agency, moral identity, and moral experience really help us understand this. Rural nurses often like have to use moral agency by advocating for patients, and when resources are limited, so their moral identity is really shaped, as Sam mentioned earlier, by working so closely with small communities where like trust, cultural safety, and long-term relationships matter deeply, and that builds a really strong nurse, in my opinion. And the moral experience in these settings often includes moral distress, knowing what a patient needs, but not always like having the means to provide it. That really like stresses out a person at another level. All of this really like shows that rural healthcare is truly a matter of social justice and ethical nursing practice, not just geography. So, with these ideas in mind, as we wrap this up, meaningful action becomes essential. And that brings me to asking a question for Melissa. What recommendations would you suggest moving forward? What should nursing leaders, policymakers, or healthcare systems consider to better support these communities?
Yeah, so some things we as nurses can do to help these communities is advocating for our patients and acknowledging and being aware of gaps in the healthcare specific to our patients and the communities we live in. So, for example, such as food insecurity, maybe there are places that have different food available. So, we have to be aware of what's happening to be able to better help our patients.
And sometimes also there may be things that we recognize or need to be changed that are beyond what we can accomplish individually. So we should utilize our nursing peers and hospital management teams to make these policy changes.
In the end, whether you're a nursing student, someone living in a rural area, or someone simply just wanting to learn a little bit more, we wanted to ask you guys, as the listeners, some questions to think about as we end the podcast. What are some resources specific to your community that you think could benefit other communities? And if any experience living or working in rural communities, what are some things you'd advocate for in terms of healthcare for these communities?
Yeah.
Thank you for joining 5 Shades of Ethics. Please join us next week for our next episode.
Thank you.